So what is this future hospital going to look like, and how has the pandemic we are faced with today going to accelerate the adoption of healthcare technologies?
Doctors are usually, they're lousy technology adopters, right?
If you're not medically trained, you have no idea what's happening in your healthcare process.
I'm not advocating, I'm not giving an opinion, I'm just being objective about what's happening.
How do you determine the severity of the condition between one patient and the next?
I see a trend that's going to accelerate, which is disruption from outside the country.
We have this network of primary care physicians that are underpaid and they're underutilized.
What if there's a misdiagnosis by the AI? What happens there?
Today, hospitals are places where people go to for diagnosis or treatments of their ills. But over the last few decades, the healthcare sector has focused primarily on treating patients when they get sick, rather than monitoring people's health and lifestyle in order to prevent them from getting ill in the first place. In the near future, however, advances in artificial intelligence, high-speed internet, 3D printing, robotics, and, as is most important now, remote monitoring technology is going to change the way treatment is given, the reason patients go to hospitals, and the infrastructure of medical facilities. So what is this future hospital going to look like, and how has the pandemic we are faced with today going to accelerate the adoption of healthcare technologies? Welcome to Restart, a podcast and webinar series, and today we are joined by Dr. Baher Al Hakim, founder of Medicus AI, which is an AI-based health platform based in Vienna. We have Ayman, who is the co-founder of Altibbi, a digital health platform in the MENA region, and Fadi Hindi, founder of DigitiAI and alghofi.ai. Thanks so much for joining us.
Thank you. Thank you for having us.
I'm going to start with you now, Dr. Baher. So in terms of your company, what was the problem and what is the solution that you have proposed through your company?
So the problem that we have identified, which is the problem that I think all of us experience, is the lack of clarity in medical communication and when it comes to anything related to our health. If you're not medically trained, you have no idea what's happening in your healthcare process. What are the tests? What test results? What do they mean? What is this condition? Why am I taking this medication? How long should I wait? There's so much information that are accessible today, theoretically, but it's really hard for people to get to the bottom of it. And they just end up, going on endless cycles of Googling and landing on websites. Some of them credible, most of them are not. And our product was designed and made to try and add more clarity so that you could just create your profile, upload your test results, add your medical history, and then you get very personalized, accurate information about what does that mean, what you should do based on it, and then providing the follow-up.
Coming to you now, Ayman. So what do you want to achieve with Altibbi in the Middle East when it comes to healthcare IT and healthcare tech?
What do we want to achieve? Great question. Our role has evolved over the past 5 years when we were with Altibbi. We've been basically following the patient wherever he's going. So we started off realizing that there's a gap in medical and healthcare content online that is accessible to everyone. And we started off with the first Arabic medical dictionary. Today, from a content platform, we've evolved to become the largest virtual primary care provider in the MENA region. What we want to achieve is to become a one-stop shop for healthcare, so an end-to-end solution for all the patient needs. We want to be there when the patient starts his journey, and we also want to be there when the patient ends his journey, and then having the feedback loop to control outcomes.
Interesting. Fadi, I'm going to come to you right now. So your business model is a little different over here. So can you first explain to us what it is that it exactly does in terms of alghofi and DigitiAI?
Sure. Actually, they are kind of independent businesses. One is management consulting on the DigitiAI side. But given that we're talking about the healthcare and IoT, etc., I think the alghofi platform that we're currently developing is about the wellness side, so more of the wearables technology in the market, and helping. The last post that I was at was I was a chief executive officer for an insurance company. So we're coming at this from an insurance angle as an insurtech to help to help insurance companies partner with a primary insurer that will want to improve, let's say, the lives of people through wellness. So this is going to be more of a wearable device that will encourage the customer through a program, be it a rewards program or be it a other mechanisms that will actually move the customer more towards the proactive side of preventive maintenance, if you will, rather than reactive. So this is what AlghoFi is working on. We've been working on a couple of products, and we've already partnered with a primary insurer, and we hope to bring something to market very soon.
Oh my God, I must say that insurance has been a very, very interesting topic for everybody in the region in terms of our viewers, our readers, all of that. So of course, there's a lot to get into when it comes to that. But before that, let's just address the elephant in the room, which is, of course, COVID-19. It has undeniably put a lot of pressure on the healthcare sector. But then there are certain arms of the healthcare sector that has benefited tremendously from the situation right now. At this point, again, starting with you, Dr. Baher, what are the major healthcare trends that you saw coming? And do you also think that the pandemic right now has sort of facilitated this fast tracking of the process of, digital trends and healthcare trends being pushed out, which would otherwise have taken a few more years?
For sure. I mean, as bad as COVID-19 was for the world and our society, I think it's been very good for digital health. Since, telemedicine has always been, teleconsultation has always been touted as the future of interacting with the healthcare system, but it hasn't been pushed because of, of the legacy and the slow pace of adoption. But with the COVID-19, no one had an option. You couldn't really go to a hospital, you couldn't speak to your doctor, and you really had to rely on those tools. And in some countries, like the country I'm living in, Austria, even because they didn't have enough solutions in the market, doctors started taking calls and they started getting paid for those calls, and they had to rush laws quickly so that they can get reimbursed and get paid for that. But that shows you the real need for that kind of change. So the trends that I've seen and that our clients have seen, since we're talking to our clients and there are more than 100 of them, is the explosion of telemedicine and teleconsultation. So laws have been drafted left and right everywhere. Sometimes in less than a week, laws were passed to enable and allow telemedicine and to have a proper business model for telemedicine. The other one is remote care and remote monitoring, because many patients that are in need of being looked after and being cared for couldn't go to their doctors or to the clinics for the checkups. So they had to do and work out how to monitor them at home and how to take care of them remotely. And then, of course, home testing, sending test kits, starting with the COVID-19, but also for the other tests. Because in some previous epidemics, not pandemics, there were a lot of challenges in caring for the chronic patients because of their inability to go do the regular tests. So providing home testing and test kits has also started growing much, much faster than before. And I think overall, a bigger change across all of this is just a new found appreciation for the role of medicine and health. In the past, medicine was always there to take care of you when you get sick. Now with the COVID-19, everyone knows what prevention is. I mean, of course, we all know and talk about hygiene, but it hasn't been in the public sphere as it is today. Now hygiene is a public policy. Everyone talks about it. Airlines are talking about their new hygiene practices and policies, restaurants, governments, cities. So I think overall it's been a positive change. And I hope that this change will accelerate the move towards not just digital health, towards just higher standards of healthcare.
Of course, a lot of points you mentioned there, the move from sick care to healthcare essentially is one major takeout from what you said. But again, when you're talking about telemedicine and telehealth, it's not just an app that we're talking about. It's essentially a change in practices and a change in business model when you just look at it from a wider angle, isn't it? So we're talking about shift away from hospitals and third-party buildings and back to the patient's home. Ayman, do you think that is something that is going to happen, where the future of hospitals is not really hospitals, it's back at our own homes?
I think it's going to be a hybrid of both. I think, at a certain stage in tertiary care, you might need physical intervention. But definitely, if you want to carve out a bigger size of the pie, that will belong to home care, or um, if you take the universe of doctor visits as a whole, or the doctor visit, definitely a much bigger chunk is going to go to home care and seeing the doctor from your own home, and we're seeing that now, right? So physicians now are asking how can they, they're looking for platforms to actually treat patients from their own homes, and patients themselves don't want to leave and go to the hospital, because today hospital has become a bigger risk for them and for others, in terms of treating themselves or other patients. And to be honest, the whole thing expedited, showing the patient that it is definitely more convenient for you to stay home, and you can still guarantee the same quality of care, if not even higher. So our motto has been at Altibbi is that we've always wanted to offer the patient at least one free trial, because we know that if you have a successful experience and the call is fulfilled, then you will come back again, because you'll realize the value of what has happened, right? And then, the call is recorded. The doctor sends you a recommendation to your own health record, which you have access to whenever you want. Continuity of care is allowed because you've seen, your previous consultations. Doctors with the right permission have access to your own record and can basically get a better feel for your history in case you missed something. So it definitely is, for the betterment of everything, having more consultations from your own home and using teleconsultations as opposed to physical visits, because you're forcing technology into it. I think today, this might be a bit outdated, the number, but 80% of providers are still using pen and paper. And now when you're treating patients from your own home, you're forced to actually do this on the record, right? You have to use some sort of a solution to record what happened, and for the follow-up visit. So it basically forced the whole migration of both the physician side and the patient side.
But that would also require a lot of education, don't you think? I mean, like you said, because a lot of people are still using pen and paper, they're not really very tech savvy. So there probably needs to be training and education provided before the entire shift can be made.
Well, before the education and training, you wanted the will, right? You wanted the doctor to actually be willing to do it, and that was the biggest barrier, because the doctor had no, it wasn't necessary for him to do it. He didn't need to do it. He was satisfied with his own lifestyle and his income, to avoid using technology. Today, the doctor's income has been hit, right? So now the will, or the onus is on the doctor now to do something about his own lifestyle, and that was the biggest barrier. Now, once he's willing to learn, the tools are out there, right? So we're happy to onboard doctors to our platforms. We're happy to teach them how to use it and get the feedback going in order to improve the platform based on their own needs.
Right, Fadi, just coming to you, would you agree with the points that Ayman has just made? So going back to the first point, where he thinks that there's going to be a hybrid in terms of there are still going to be hospitals, but a lot of our checkups, etc., are going to be done back at home. Would you agree with that?
Yeah, I would, and I think from the management consulting side, and what we've seen with a lot of clients that are in the healthcare sector, and more specifically, we're working with a large Ministry of Health that is actually looking at their appointment system now differently, and looking at the importance of digital information and being able to use things like artificial intelligence, especially in the wake of this pandemic, to be able to do, let's say, customer, like categorization of customer based on similar attributes. So there's a lot of things that are happening now that we would have never thought, large organizations would be looking at, or would be considering to, as Dr. Baher had said, would be considering to do a hybrid model between home and hospital. between to actually get in and start looking at AI and machine learning on customer data and try to basically do predictions. And these would have been unheard of at the beginning of the year probably. And now this is all happening, and something that is being worked on actively in engagements, because we want to leverage technology, and we want to leverage and move towards this zero-touch economy. They're talking about a second wave of COVID, God forbid, but potentially they're talking about a second wave later on this year. And even when the vaccine for COVID comes, I think we've seen the change of the world where there will be more viruses that are going to come, and we have to be ready for that. So I think that our world has changed forever as a result of this pandemic, and we have to get prepared now. Again, I'm not saying anything that people don't know already. We have to prepare for a life that facilitates or promotes this hybrid model and can deal with future pandemics as well.
So since you've just mentioned it, that there is a second wave of COVID-19 being predicted maybe in the next few months, but do you think right now with the facilities that we have and the infrastructure adoption that has taken place in the healthcare facilities, we are ready for it, or we are better prepared than we were for the first one? Fadi?
Definitely, I mean, for sure. I think across the world, they've, you've seen what happened with the epicenter of the pandemic that started in Italy, then moved to New York, then moved to Brazil, and the way that they've done and dealt with and obviously starting in China, but the way that they've dealt with the breakout of the virus, and they've been learning from each other about what's the best way to get this under control and flatten the curve and make sure that they have enough beds and hospital and space to address this. So I believe that the world across all of the world is a bit more prepared now. But again, similar to the discussion that we started at the beginning of the webinar, prevention is better than reaction. So bracing for a second wave, and what again Dr. Baher was talking about is the hygiene is becoming more of a law than it is a nice to have. And similar also to some of the things that Ayman had talked about, it's important that we the actual culture, the culture shifts and continues to shift towards. I think that's how you're going to be able to control that second wave, regardless of how many beds you have. People have to be responsible for their personal hygiene and what they're doing, and God forbid if they have an infection, to self-quarantine. That's what's going to make a difference.
All right, just coming to you now, Dr. Baher. So just getting to your expertise in terms of AI. So AI right now, correct me if I'm wrong, is being used as a diagnosis tool, and it's not used as much in treatment. Do you see it going beyond diagnosis, maybe in the next few months when it comes to treatment and contagious infections and the spread of it?
Of course, and this is something that already, it was already happening, but in more controlled experimental use cases. And an example, by the way, is just caring for the chronic patients that may have COVID-19 or may not have COVID-19, is how would you be able to know? Because even today, after more than 3 months of living with this disease, there is still some contested opinions about what are the hallmark symptoms for a patient, and how do you determine the severity of the condition between one patient and the next? Is it depending on the age? Is it depending on existing conditions? Is it depending on the immune system? And the best way to really look at all of those parameters and to learn from them and learn from the previous cases is to implement and use AI. So AI has been used first and foremost these days to look at the COVID-19 and the complicated cases, but now it's being used in all of the other cases. It's the same principles. AI basically just looks at the data and picks up patterns and then learns from those patterns, and in the future can help you predict what may happen. And now it's being implemented more towards other chronic patients than just the COVID-19. And of course, I mean, with the upcoming second wave, which is almost certain, but no one knows for sure, people are trying to be more prepared by having those predictive models implemented on a bigger scale, by having the data stream coming from hospitals being either prepared, implemented, or cleaned up to be used for those cases. And I think it will just be, again, a point for the use of AI in analyzing health data for predictive and for treatment, not just for diagnostics, but even for diagnostics. I mean, you hear about using it, but still it's not being used on a mainstream basis. But this has been changing over the past few months.
Right, like with regards to AI, I have one major concern, which I'll get to when we're talking about the challenges. But before that, again, Fadi, you did speak about wearable technology, etc. So there were theories back in 2018, 2019, where it was said that each human being will have like a computer chip attached to their body for all their medical data, just to collect it, collect it and stuff like that. It does make sense logically, but is that really going to happen, or is this one of those Terminator philosophies that we're just going to hear about or watch in sci-fi movies?
I mean, that's a good question. I think it would. My opinion is that it is going to happen. There is a big divide in opinions about privacy and personal information based on the generation that you are in. So if you're my generation, privacy and sharing information and putting your life on display is not at the forefront of my mind or something that I want to do. But enter millennials and now Generation Z, they don't care, right? If they're sharing their information is going to give them better health, it's going to give them let's say better offers, they don't mind, right? They'll share their information.
Considering we're having all of these conversations about privacy, etc., with Cambridge Analytica and stuff like that, I mean, I think people are more cautious of their privacy and their personal information on there.
But what I've seen is that as time is progressing, the generations don't mind sharing their information versus older generations. So you're asking me, are we going to see that day when there's a computer chip? I think we will see it, where there's going to be a certain group of people that don't mind having that chip because they're going to, their heart condition can be immediately spotted by a paramedic that's coming to, rescue them or something or the other, and others will not. But again, the privacy issues and how you're going to be able to maintain the privacy or ensure privacy for people by using such, technologies that are inserted into, there's going to be the barrier for the mass adoption of that. But if you take a different look at this, what I think is going to have a mass adoption in the coming 2 years are the wearables, right? So there's no issue today with a Fitbit or an Apple Watch or an Android watch that you can wear and take off, right? But in a way, it's beginning to report a lot of information about you already. Your heartbeat, your number of steps, your sleeping patterns, so there's so much information that's being collected. They can do an ECG now with an Apple Watch. It's not enabled here, but it's enabled in the US and other regions. That could be done through the watch, and that could be communicated if you give the permission for your doctor to see the ECG. So you can actually see how we're not that far, Now the actual implementation of the chip is where that barrier comes. But there might be, so to answer your question, I think we're moving in that direction, but there might be a hybrid model again, where some people will say fine, some people say no, the watch or some device I wear and take off is okay.
Very interesting, Fadi. I had no idea about the ECG being facilitated by Apple Watches. But again, this is, again, you said in the US, etc. I just want to bring the conversation back to the region. And Ayman, I'm just going to bring you in. At this point, what would you say is the current state of digital transformation in the healthcare sector across this region?
So the healthcare sector is usually the last sector that goes online, right? And the region already has its own challenges when it comes to telecom infrastructure and IT infrastructure. So, and then you want to add healthcare onto that, it's still lagging compared to the rest of the world and compared to other verticals. And you know, if you want to look at the healthcare sector in terms of components or parts, when you look at the patient side and the doctor side and the technology, the doctors are usually, they're lousy technology adopters, right? They're given the state or the track of their specialty and the time that they consume in actually specializing, they really don't have much time to do anything else, and that makes them at least, later adopters in terms of tech. Patients and healthcare, even in an offline world, the patient is not proactive when it comes to his health, right? They don't worry about their own education, prevention. If you smoke, you don't worry about your smoking until something happens, which is potentially 20, 30 years down the line. Because the effect is not immediate, there's not much turnaround that happens on the patient side. So you have that on the doctor, that on the patient, and then coupled with the IT sector in general, it's causing the digital transformation pre-COVID to actually be a bit late. But then what happened in the last couple of months forced everything, forced the behavioral change on all these fronts, right? Even on the on the technology side, for example, last week we launched the Ministry of Health in Egypt a COVID hotline, and now we're getting around 20,000 consultations per day from Egypt alone. And we're actually trying to resolve the infrastructure issues that are happening as we go, right? So we're working with Telecom Egypt to fix the actually fundamental issues in the technology infrastructure in Egypt. And we're trying to recruit doctors to get them online, train them on the app. And patients basically are being aware of this through the ministry itself and through other networks where we're actually helping in marketing. So we're definitely expediting this, and what's happening in the past couple of months is definitely assisting and facilitating that.
Right. So when it comes to adaptation, you said that we are late adapters when it comes to the Middle East and GCC. Why do you think that is, and what is the main challenge when it comes to healthcare IT, Ayman?
Well, you want to start with IT in general. Like, internet penetration is still lacking, right? So you still have people who are not online. So that's the biggest challenge today. You want to get the people offline, online, which I get it, it's in rural areas, but still our internet penetration is not up to at least OECD countries, for example. And then when you want to move from that into healthcare, basically there are other infrastructure issues as well. So today, for example, payments on digital payments online are still a big barrier. So even if the patient comes in and wants to talk to a doctor or wants to use any telehealth product or health IT product, sometimes payment is a big barrier, right? So financial inclusion is also a barrier to health IT. And then when you want to move into the healthcare itself, as discussed before, regulation is one big barrier. So in places like the Levant and Egypt, regulatory instruments for telehealth and telemedicine are not there yet. You barely have medical malpractice laws in these countries. So and that's even one step before. So regulatory issues are definitely another barrier. And then
when you're talking about telemedicine, I think all three of us have spoken about telemedicine briefly. Is there a special license that is required to practice it?
Yeah, so in the UAE and Saudi, the UAE they launched they drafted a telemedicine law 2 years ago, and it's per emirate or per city, which also makes it less convenient because you want to get a license from the Dubai Health Authority, and then you also want to get a license from Altibbi, and you want to get a license from the Ministry of Health. But at least they were the first ones that actually created a regulatory framework for the use of telemedicine and telehealth. Saudi also has a law now, and they've been really great at getting the feedback of the health tech startups and actually expediting the licensing process, which we're going through right now. And in other areas, it's still not there. And then you move from telemedicine to e-prescription, which is the next step that they're doing in the UAE, and that's also happening in Saudi. So I would say BTC has been an earlier adopter of health IT, and they've been doing good in making the environment conducive to private enterprise when it comes to that.
Right. I'm just going to remind our viewers here, the ones who've logged in. So if you do have any questions, just post them and I will be taking it up with the panelists here. But right now, I'm just coming back to you, Dr. Baher. So this is the point that I had earlier, which I'd saved for now, essentially, which is in terms of AI, it's still not 100% apt and accurate, right? So there's still a lot of challenges, and one of the major challenges with AI is the bias in itself, the corrupt data, which is facilitating the bias in AI. So when you're talking about a social sector like healthcare, there is absolutely no room for mistakes. So do you think right now would be a good time for absolute adoption of AI, or is that still a huge challenge we are facing?
Well, I mean, you're right. Definitely, AI has a lot of challenges. And like whenever someone talks about AI being the magic solution to everything, or someone saying AI is the worst thing that can happen, don't believe either of them, because the truth is in between. AI is an amazing tool, but it has a lot of challenges. AI today should never replace a medical expert looking at a case or a patient. But AI can help us sift through the noise of data and can help us pay attention to certain either patients or parameters that we would struggle to get through with today's chaos. And COVID-19 is a perfect example. You had healthcare systems that just ran out of people to look at, basically to medical experts to look at patients. And how would you know if this patient really needs life support or if this patient is fine if you don't have even a very rudimentary form of AI, which is basically those assessment tools, just ask you a few questions about your symptoms and maybe your age and pre-existing conditions, and just tells the hospital or the physician that, okay, look at this patient first because this patient has a high chance of being a high-risk patient than another one. And I think that's a good start. With today's ecosystem, the data is being collected and looked at in retrospect. So not only do you rely on the data to, to deal with what's happening, but also you look at how accurate the data was, and then you improve your modeling. And the whole topic of bias is now being tackled on a policy level. So in all of the countries in Europe, the States, China, now there are new laws that are being drafted or being already implemented, or guidelines that determine that part about the bias. You need to make sure that your data is not biased, or you need to communicate the kind of bias that your data has based on the sample of patient data that you've accessed, or the geographics or age group. So the challenges are there, but on a global level, people are aware of those challenges and they're trying to tackle them in a systematic way. It's going to take some time till this is implemented, but in the future, it's very similar to the GDPR, the big privacy regulation that was instated in Europe. You will have similar regulations for all kinds of AI use. First and foremost, in healthcare, you're going to have a long list of features and requirements that any provider needs to go through and be validated against before they can offer their service to the public. But that's probably a few years away from being implemented.
So as of now, AI is just going to be a predictive tool that assists the physician, and it's not really going to take the physician's job then.
And honestly, I don't think that's going to happen anytime soon.
I actually believe in, I want to echo what you're saying, Dr. Baher, because it's not going to replace the physician, not anytime soon. We do have our own machine learning modules, and we have a supportive diagnostic model that supports the physician. But in terms of replacing them, you really want the patient's buy-in, right? If the patient doesn't want to see a robot, then he's not going to see it. And the patient, if the doctor does not prescribe the patient anything after a consultation, most patients are left wondering if the doctor actually treated them, right? They still are under the perception that the doctor needs to prescribe something for me to actually have been treated. Can you imagine replacing the doctor with, with a robot? We're still, we're still far from that. To interrupt, Dr. Baher.
So I have a couple of points, if I may.
Sure. Please go ahead.
Okay. So on the topic of AI in medicine, I believe Dr. Baher hit on the predictive side of artificial intelligence, and all valid points, of course. And I agree on the thing with respect to the handling the bias, etc. But there's another discipline within AI that we tend to forget about, which is unsupervised learning. And in unsupervised learning, what you're doing is you're unleashing the computer on finding patterns in the data set, right? And I think that there's a lot of work that can be done in healthcare with unsupervised learning, right? The clustering of patients, and obviously, I mean, I'm not saying anything, again, that people might not have heard of, but it's actually just getting down to the point where we start using machine learning on data sets that we need to prepare for the machines to find these patterns and create these clusters of recognizable patterns, or things like anomaly detection. So there's quite a bit that can be done. So there's the prediction side, and then there's the kind of the unsupervised side, which I think is also something that could be used. On the second point, I just wanted to share like a personal experience with you guys. When we were presenting to a lot of, I was doing a session for a lot of ministries in one of the GCC countries. And we were talking about that particular point of, would you trust Watson doctor over versus an actual human being? And the conversation was really interesting, because in the beginning, there was a lot of more yay than no. And as the conversation progressed, when we actually started explaining, okay, so here's how it would work. Watson, the Watson doctor has X million of records that have passed through to be able to identify and diagnose patients, and they'll be able to do this, and their accuracy is going to be so much higher. And they're going to be able to, through machine learning, they'll be able to assimilate information quicker, and they're going to be the best doctor with the highest accuracy. The more that we got into it, the majority is actually shifted back towards the no, because they want that human doctor, right? People don't, no matter how much you explain that the robot or the technology is going to be more accurate, it's going to be more up to date. Ayman, I think, was hinting to this, you need that human touch. So again, we go back to the hybrid model of doctors that are that have access to AI and machine learning platforms that have all these cases to provide the diagnosis for the patient would be the way to go.
I think it's a very, very interesting conversation there, and I'm going to open this to all the attendees who've joined today as well. What would you prefer? Would you prefer a Watson AI doctor or an actual human doctor? What do you guys think? I'm actually curious to know. So what's the opinion like here? I know for me, I think I would prefer a human doctor. So I think I'll start with you, Fadi, because you started.
No, I think for the diagnosis, I'm okay with an AI doing the diagnosis. But then, for the actual treatment and options, then you want to talk to a human doctor.
Right. How about you, Dr. Baher?
Well, and for my part, I would prefer to have the AI look at my records, at my history, to come up with certain, either predictions or conclusions, and then for the human doctor to review those results and outcome, and then to make a judgment call. Because I think which is what Fadi mentioned, going through, because in my history, if my data is collected, there's so much information in there that no human is able to comprehend. You usually look at the past, just one test and maybe what you've done in the past year, but no one looks at what you've done 10 years ago, how your lifestyle was 10 years ago, where did you live, what kind of job did you have? And looking at this data can tell a lot about what I'm going through right now. So I would have the AI go through all of my history to provide all of the important points to look at, and then for the human doctor to look at it and decide if this is relevant or not.
Wow, these are such professional answers. I feel like changing my answer right now. But Ayman, what do you think?
Oh, well, I'll just spice it up a bit. But no, you want the care in patient care, right? So the care is not going to come from a Watson, right? The care has to be a human touch or a human intervention. At least, with that part, I would want a doctor, but I definitely agree with Dr. Baher that I would want the robot to give the doctor the universe of possibilities. So, what AI does in diagnostics is that it provides you with that 1% or 0.1% chance that you might, for example, have stomach cancer, which, a doctor, for someone who's healthy like me, or, given my age demographic and my health history, the doctor would just skip it, right? But you need someone to remind him that this is still a possibility, and you might want to check for that, given my symptoms. So that universe of possibilities, that's always going to come from an AI agent, and not from and you'd expect the doctor not to remember that every time. But in terms of caring and providing empathy, you want the doctor.
But it also boils down to trust, doesn't it? I think a lot of people at this point, they do trust their family doctors, which is why they're very hesitant when it comes to changing doctors, etc. And I'm not sure how many people trust robots at this point, especially now because we're not really used to interacting with them.
One more thing is I'm not going to be able to challenge the doctor, the AI robot, right? So I read about these things. I'm a stickler, and I might want to ask questions and challenge the doctor's decision or diagnosis, right? I might be just a nightmare patient, with the doctor, but I'm not going to be able to do that with a robot. At least, ask him, why did you think of that, or where did you get that from, and what if this and what if that, or add on. I would be able to add information in my history that might not be able to be plugged into any epidemiological model that would assess me, right?
For sure. So I think now again we're talking about the different challenges, and we've sort of moved away from it. But coming back, and again, Fadi, it's your turn now. So as an insurance provider and one who deals with a lot of insurance services, etc., that is one.
Used to be an insurance provider.
As an ex-insurance provider, but somebody who's been in the arena for a while, I think you will be aware that one of the major problems that people have here is with the cost when it comes to getting medical treatments in facilities, which is why outbound medical tourism from this region is higher than inbound medical tourism. Do you see that as a problem being addressed post-pandemic?
I think the pandemic is forcing everybody to stay where they are and basically make do with the existing facilities and resources, be it tourism or medical tourism or whatever you want to call it, right? So I think by default, the quarantine is forcing that to happen. The cost, there is a rising cost of, just speaking with my fellow CEOs from the insurance company here in the UAE, obviously there's a rising cost of healthcare with COVID, not only as a result of treatment for COVID, just for people that want to get tested, and that's going to cost money at the end. It's not free. So there's definitely a cost that this pandemic is definitely bringing to the overall loss ratios of the insurance industries, and it's impacting the medical portfolios of insurance companies. So I think that we go back. If I take a step back again as an ex-CEO, and I think about the most logical step, whether pandemic or no pandemic, we go back to this preventive concept and being proactive with the consumer, or the patient, or the customer, whatever you want to call them. And the important, any insurance company that is not moving towards this proactive model and working with a patient, be it healthcare, or not, or general insurance. They're not moving towards the proactive model. I don't think they're going to survive in the long run, because there's going to be so many disruptions that will come to bring about that change so that we can lower the cost. I'm sorry.
Yeah, so that pretty much is the question then, right? How do we improve value for patients without really increasing the costs at this point?
Right now, the adoption of innovation and technology, be it AI or wearables or whatever it is, that the speed of adoption for the technology, to me, if you ask me, especially like right this minute, you caught me at a bad time. So I can tell you that it is very important that we have the support of providers and the regulatory framework as well. That's going to enable the diffusion of innovation through the country or through the countries. So everything that we've talked about, by the way, will stop if the regulations do not allow you to implement some of these things. So if you go through and we're going to lower the cost, right? So we'll have somebody that will do the diagnosis so that we don't need so many doctors. What if there's a misdiagnosis by the AI? What happens there? This is where the regulation is going to come in, and things are going to get bogged down for you to be able to move forward, right? So to answer your question, we definitely need to lower the cost. We need to move towards proactive maintenance or proactive insurers and providers. But then it's a catch-22 because regulation has to catch up. Providers have to be updated. So these are, I think, would be the barriers that we have to overcome. And the interesting thing about the pandemic is that all of a sudden, what seemed to be impossible now can be done in hours. And hopefully it's not going to.
This is the point. Fadi, you touched upon an amazing point, and this is what I want to also mention. Since we're involved in around 15 different markets, we could really see and tell the difference between the markets that are doing it, or even countries and governments and policymakers are doing it the right way, and the ones that could improve in the way they're doing it. And it's all about preparing and working on the policies and the regulatory aspect. You could enable any kind of innovation and transformation of the healthcare system if you really figure out the right incentives. What is telemedicine, from the technology perspective, has been ready for almost 10 years. I mean, of course, there are challenges with the bandwidth, but the principles has been there. What's been lagging is the regulatory and the reimbursement frameworks. Can you actually do a telemedicine session? Can the physician get paid for it? Can the physician be part of it? Can the patient request it? Is it mandatory? And in many countries, when they enable the right regulatory and reimbursement infrastructure, you see innovation moving really fast, because you have a lot of businesses and a lot of willing adopters, both between the healthcare system and between the general population, people like us. Not everyone wants to go see a doctor. If it were up to me, honestly, I would do all of my visits remotely, unless I need to go for a test. And for most of the tests, I would want those tests to be done at the office or at home. Why should I waste my time and go somewhere if I can pay a bit extra and get these things done at home? But today I can't do it because the local laws do not allow me to do that, and they do not allow the lab to do that. They do not allow the physician to do that. And those are the parts that really need to move fast. And the pandemic, what Fadi said, has proved that these things can happen in one day. So in the future, the policymakers, the governments can't really say that takes some time, because we've seen that this can happen really fast, and it needs to happen faster in the future.
Ayman, yes, I wanted to come to you as well with the same point about the role of government in terms of increasing access through policies and approvals, etc. Right now, what the government essentially has been doing, and like both the other panelists have mentioned, it has been restricting access to a lot of the services that are already available. So how is it that they can increase it and facilitate it?
Well, it hasn't been restricting per se, right? You just don't want to wait for their permission. You start doing it until you're significant enough for them to regulate you. Right? That's how Uber started. That's how other technology companies started. So with us, we keep saying it's 21st century technology with 20th century regulation. So, you have to start and you have to find ways around the system, right? As long as you're just being mindful and ethical and respecting the boundaries of between the doctor and the patients. Because we've been doing primary care for the past 4 years now, right? And in places like Jordan and Egypt, there has, till today, there is no regulation that that actually covers telemedicine. But that also means that it's not illegal, right? Because there's no law that determines that is telling you that you're not allowed to do that. So that's just another way of looking at things. And for us, we're doing both, increasing access and reducing the cost. The way we're reducing the cost is that we're utilizing the GPs, which are basically underutilized and underpaid in all of our regions. So, having a gatekeeper model where the primary care physician would act as the first line of defense and would tell you, okay, there's nothing wrong with you, stay at home, or you need to go to a neurologist, or you need to go to the ER, because today, most patients in the Middle East, if they have a headache, they go to the specialist immediately instead of going through, first, some triage and then primary care, and then if need be, which is not in most cases, go to the specialist, right? Most of the time you need reassurance. And so what, the opportunity for us is that we have this network of primary care physicians that are underpaid and they're underutilized, and they're working in different government or private hospitals, but they're not adding the value that they could be adding, mostly because of regulation, one, and because there's a culture on the patient side that doesn't believe in seeing a primary care physician at the beginning. So we're using them in our platforms online and bringing patients to basically do consultations to most of the scenarios that actually don't require a physical intervention, which are a lot, and we see it's the nature of the beast when you want to discuss basically your consultation or your case with a doctor over the phone. You're not going to do it when you have, when you need 911 and when you're like in physical pain and need to go to the hospital, right? You're going to do it for the bulk of the cases, the common cases that, the common cold, pink eye, rash, the stuff that actually makes sense for you to actually do it at a distance. And so, us having primary care or virtual primary care both increased access because we're now in all of rural areas, and reduced cost because we're using GPs, and we're using GPs during their downtime, which means even they're willing to accept less for a consultation because their opportunity cost during their downtime is low. There's nothing else to do, right?
For sure, some very key points that you've mentioned, but then I think one of the points, even when the situation is not like it is right now, it's not a pandemic situation because obviously this was unseen. But then when you're talking about medical professionals, there's a burnout essentially, especially in this area, in this region where you have lesser professionals and the demand is much, much higher. So how is it that we can address those issues?
For us, we definitely have a quality control, a QA committee that monitors basically the phone calls of physicians, and we're very strict about these things. So even on the onboarding side, we make sure that the doctor is certified and passes a couple of exams, whether they're written exams or an actual teleconsultation that they do. And then we keep on doing random sampling, and we're, with the right education. We basically tell the doctors that, be mindful of your own time, even if you're doing it off hours. They usually do it during days off, and they do a couple of hours, so they don't do, it's not like they're doing another 8 hours per day, right? So, and if they would, it would have been picked up with, by our QA committees or based on patient feedback.
Right, and finally, there's just one point that I'd like to mention because we are talking about healthcare IT, healthcare tech, which is the topic of data parity that I think we need to address. So when we're talking about like a global sort of world where telemedicine, telehealth, telecare is going to become the norm, there are also certain countries where access to internet and high-speed internet isn't as much as it is in other countries. So will that not prove to be a problem? For example, there are so many countries that are introducing 5G technology very soon, so perhaps this year or next year, and then there are countries elsewhere where they don't even have access to 3G technology or 3G internet. So how is it that this problem can be solved with the elimination of physical healthcare facilities? I'll start with you, Fadi.
I mean, I think the introduction of 5G is something that's definitely been, a lot of people are watching that because of the, I'm not going to bore you with the same message, the velocity of information, the quantity of information, and the IoT, and everything is going to be connected. We know that's happening with 5G. So I think the actual, my belief, because I'm I'd like to think that, more futuristically and digitally, is that we're going to move away from the hospital model, the physical model, kind of like what we were talking about earlier. The introduction of 5G is only going to help because it's going to accelerate the ability for us to do things decentralized and have the hospital kind of concept broken down into maybe factories of specialization for labs and this and that or whatever, and then more of the in-home testing that gets be it that it's a wearable that's transmitting the data to a central location where doctors and nurses are monitoring, or in-house a collection of samples that goes to some kind of a central location for processing, etc. But it's all going to be data-driven, right? It's all going to be about information flow through that network. That's just my opinion. It might be kind of out there.
Sure. Dr. Baher, so in terms of data parity, what is your take?
Well, my take is honestly, from an infrastructure perspective, there's nothing that we can do as in companies or even experts working in a system. This is a problem on the government capability of providing the right infrastructures and support in the different countries. But the problem that we see, which is even a problem that I didn't even realize before we started working on the solution, is the data interoperability. Is that you have the connections, you have the data available between multiple providers, but the data does not talk to each other. So you have the same patient having their data between two systems. If you put it together, it doesn't work. And this is even a worse problem because then you think if you improve and work on the infrastructure, the problem is solved. It's not. You have another problem, and an even trickier problem, because the data has different coding standards. Sometimes there are no coding standards. There are different systems. Some of them are too old to be updated, and you have new systems that are inventing their own standards. And this is becoming really hard for us, especially when we're working in advanced countries. This problem is even more complex because they have more standards that you have to figure out how to translate between each other. But the infrastructure is definitely the bigger problem, but it's the problem that we can do much about. The interoperability is the one that we feel we can do a bit about, and we're trying to work on it.
I have a point, Dr. Baher, this is 100% agreed. And again, just being Star Trekky here, I see a trend that's going to accelerate, which is disruption from outside the country. And there's nothing that the country is going to be able to do about it. I'm not advocating, I'm not giving an opinion, I'm just being objective about what's happening. So when Google or Elon Musk or one of these guys, Jeff Bezos, makes a global network available for people to access from their mobile phones, all of a sudden the barrier for getting on the internet is eliminated, right? So then we get into the point that you raised, which is the interoperability, which is the silver bullet that will kill any you know, end-to-end, you know, patient integration. And this system talks HL7 and the system doesn't talk, I don't know what, and this system needs a text file, this is where things will get bogged down. But I agree with you, but I just wanted to raise the point about this disruption that's coming from outside the country. And if you guys take a step back and think about it, I think in the coming 5 years, there's going to be more and more of this that's happening. And the globalization is going to take place, whether the regulator wants it or not. And I don't know, I think it's interesting.
I mean, I'm hoping for it. Don't get me wrong, I'm against it. But you know, today, since healthcare has always been a regulated industry, it's not as easy as, you know, releasing Netflix in the UAE. Like a global provider of, I don't know, insurance or even telemedicine can simply offer their services in the UAE without talking to the regulators. And this is why it will take longer. I'm hoping and I'm expecting some of these global solutions and global disruption to impact local regulations, but it's going to be harder than, you know, what Facebook, Netflix.
I agree, and I think. Financial services, healthcare, and insurance. I don't know if I'm missing anything. Maybe, yeah, basically financial services, healthcare, and insurance are highly regulated. And I think they're going to continue to be, not only in the UAE, I think in the region, I guess across the globe. You know, let's not kid ourselves. And you're right. I mean, the disruption will be a world where, for example, let's talk about an insurance, like a serious disruption, where an insurance company from outside the UAE will actually insure you for UAE, you know, related things, or a healthcare provider will, again, provide you testing and medicine from outside the country. And again, at this point, it will only be, will the regulation stop remote diagnosis and remote medicine delivery, for example? This is where we're going to start getting into these kinds of problems.
And
sorry
probably
for making this futuristic for you, Shruthi, on this call, but I'm like really pushing the boundaries, and I think this is what we need to do as entrepreneurs.
I agree completely, and I think like right now is the best time to have this conversation, right? Because resource sharing is anyway happening right now. A lot of expertise from China is being outsourced and it's being supplied to different parts of the world. So that is sort of happening during a pandemic. So it's just sort of building on the momentum and riding on this bandwagon for a longer time. I'm just going to take a question.
Sorry, I want to add one more thing on the infrastructure, because we've dealt a lot with that, and all our problems have been in the past 4 years infrastructure problems. We started the telemedicine service, you know, it was tough to do it through basically a video consultation. Well, it wasn't tough. We started with video consultations, but then the first thing that the patient would do is switch off video, right? And so when you move into, when you want to go into VoIP, you have a lot of technical issues and regulatory issues that are preventing VoIP. So we switched to telephony technology that actually connects doctors and patients through GSM codes, right? Using trunking technology. And then to your case, Fadi, we actually had to use telephony technologies in the US that are covering phone lines in the region, and the quality was horrible. So we were using Twilio basically to connect the doctors and patients. And we've had infrastructure issues, right? So what we did is we tried to enable local players, local telephony solutions, where we're like, listen, if you start doing this, I can give you 20,000, 30,000 minutes per month just by me being your client, right? And the quality of the call is going to be much better. And today, when I guess, Shruthi, to your question about the 3G, people lacking 3G, we're actually dealing with that today. Like when I talk about the hotline in Egypt, you know, these guys don't have apps, the ones that are living in rural areas. So what we did is we're working with the telecom operators to create some sort of a hotline through basically PRI technology or SIP trunking, where we're connecting the doctor and patient through their operators. And these are infrastructure challenges that are enabling us to solve and get to these patients. We're actually getting involved in solving these infrastructure issues. And it's a pain, but you know, The pioneers get the arrows and the settlers get the land.
Yeah, I think that's a great note to end this conversation on. We've already gone over time, but then just so many new topics discussed and so many points brought up. So thank you so much for those valuable insights. But then I just want to take one question from some of our attendees. We did get a lot of responses for the previous poll that we had about what's in doctor or actual doctor, and looks like most of them agree with you that they do want an AI-based platform to do their diagnosis, but they want the human interaction as well, is most of the common responses I can see in front of me. But one question that we have is, most visits to the doctor lately end up with a generic prescription of pharmaceuticals. Do you think involving AI in diagnosis and treatment could present an opportunity to provide a more well-rounded treatment, which would include things like lifestyle changes, exercise, diet, optimal sleep cycles, etc.? I'm going to leave it up to you. Whoever wants to take this question can take it.
I mean, I can say something here. What's being described is exactly what's also being, discussed for more than 10 years now, which is called personalized medicine and holistic medicine. So personalized medicine goes into, there is no one pill that could work, even a painkiller like a Panadol or any kind of antibiotic. There's theoretically speaking, there's no one pill that could fit all cases. And if we know enough about the person and their profile and their history and their biomarkers, theoretically there is a case to manufacture and design a specific medication that fits the exact case. Of course, I mean, a treatment is much more than a medication, which is what the other parts go into, which is the holistic medicine. It's not just about providing medications. In many cases, the treatments could be just a few changes in the lifestyle, or you being aware of a few things and looking at your health differently. And all of these things are coming more and more into the light. You see more and more companies, whether in digital health or in traditional pharma business, this whole digital therapeutics is combining the medication with the digital companion that asks you questions, provides regular assessments, makes sure that your mind, body, and the medications are being optimized to the most optimum level.
For sure. Great. Thank you so much, Dr. Baher, Ayman, and Fadi for joining us here and for those valuable insights. I've definitely learned a lot about the healthcare sector. And looks like the future of hospitals is going to be not really a lot of hospitals. But again, thanks for joining us. And thank you to all the attendees who participated and who joined in our discussion today. This was the Restart podcast and webinar series, which is basically a 10-part series that deep dives into future of different industries, given the condition and circumstances we are in right now. We will be back again soon, so watch this space.